So kids are exposed to a lot of different germs now that they're back in school. And here now with tips to keep them healthy is Dr. Jamie Friedman. And thank you for being here this morning.
Good morning.
Oh my gosh, we were just talking about this because the kids get sick, then the parents get sick, and now we're sick at work. Oh my goodness. Okay, what are the most common illnesses that you see during the beginning of the school year?
Right now we're seeing a lot of colds and coughs. We'll start to see some stomach infections, influenza as the winter goes on, and little babies will see something called RSV, which is a little bit more of a severe cough and cold type illness.
Okay, so a lot of colds. I'm seeing that too, and sometimes I can't even differentiate if someone's got allergies or actually has a cold.
That's a hard one.
Well, how do we keep this from spreading though? Like, how do we keep it from even from the kids?
Yeah, so the best thing you can do for your kids for dangerous infections like measles and chickenpox and the flu is get them their vaccines. For common colds, the best thing they can do is wash their hands. So teaching them how to wash their hands, how long to wash their hands, how to do it properly is really, really important. And also when to do it, before they eat, things like that.
Okay, and when you say wash your hands properly, can you talk to us about that? Because right now it's International Clean Hands Week, so how often should we be doing it, and what's the proper technique? Because I've heard a number of different things.
Right. So you don't have to use necessarily antibacterial soap, but you just need to be using soap and water and washing your hands for a good 20 to 30 seconds. Tell them that they should sing ABCs in their head or happy birthday. The other thing is to keep the germs off the hands. Have them cough or sneeze into their elbow, not onto their hands.
Okay, so you said 20 to 30 seconds.
Yeah, it's a long time.
It is, and sometimes I catch myself, like you're doing it really quickly and maybe 10 seconds, and I'm thinking, that's a long time. 10 seconds is a long time.
It is.
Okay, so 20 to 30 seconds, just to be sure, definitely before you eat.
Before you eat, after you sneeze or cough into your hands, after, of course, going to the bathroom.
And I feel like because sometimes you'll touch your face sometimes, and imagine how dirty your hands are with all the germs.
That's a really good point. Instructing your kids on keeping their hands away from their face is really important. I bet if you were to sit in a classroom and watch how many times kids are touching their face, touching their papers, passing things to their friends, and their friend is touching their face, oh my goodness.
Okay, so if your child starts to have symptoms for the common cold, for instance, when should parents actually keep them from going to school?
That's a hard question because you never know when they're first getting sick and already spreading the germs, but clearly if they're too unwell to sit in school and to concentrate, so having a fever, can't stop coughing, tired, not eating, drinking well, they should definitely be at home. Any viral infection like a cold is going to be contagious the first 3 to 4 days, which is generally when they're going to feel the most sick, and that's when they're going to stay home. Some kids, if they've been coughing, they might be coughing for a week or two. At that point, they're probably not contagious. They should be in school, as long as it's not disruptive.
Okay. And so my question is, so say they get sick at school, and then you've got other kids at home as well. Is it possible that you can keep them from getting sick, or is that just kind of a given? They all get sick?
I think it depends on your household and how you guys operate. It is possible. I mean, if they're not sharing their cups and spoons and stuff, and everyone's washing their hands, and maybe the sick child's off in their room a little bit separate, it's possible. I mean, if you're younger kids who have less immunity, they're going to be more likely to pick up something from the older sibling. That's generally how we see it in the office. Well, so and so comes in because the siblings were sick.
Okay, and so if they come home and they're sick, you're keeping them from going to school. When is it a safe time to send them back? You said maybe a week or two, like they've been...
Well, a week is a long time for a cold because they're probably going to feel better after a few days. So even if they're still a little sniffly and coughing, they're probably fine to be at school.
Okay.
It depends on what's going on. I mean, so again, you have to look at, can they be in school and concentrate and feel well? Are they going to last through the whole day? Plenty of parents give their kids some Tylenol, send them to school, and they're off to work, and it's the Tylenol is going to wear off, right? And they're going to get sick again. And other things like pink eye, they have to be on eye drops. Strep, they have to be on antibiotics. Pneumonia, they have to be on antibiotics. Certainly with stomach infections, they have to be better so that they can't spread it or, and so they're not in the bathroom the whole time.
Right. But this is also really good information just for parents, like just for you and I, like we've got to make sure that we are washing our hands and for 20 to 30 seconds. That's a hard one. 20 to 30 seconds every single time. Dr. Friedman, thank you so much for